I am Dr. Raghuram. I am a pediatric hemato-oncologist at Aster Group of Hospitals. Today I want to talk about one of the common blood problems which happen in children, which is children presenting with low platelets. Usually these children are playing around well and suddenly present with bleeding from anywhere, from the nose or from while brushing their teeth, or parents notice what they think is a rash with spots on the body, and they go to their pediatrician and they may be found to have low platelets. And the commonest reason when the child is otherwise well is a disease called immune thrombocytopenic purpura or idiopathic thrombocytopenic purpura. Here the children are otherwise well, but due to some reason have a very low platelets, and this is thought to be due to that these platelets are being broken down by their body by the antibodies which are produced, usually stimulated by an infection. These children usually do well. Most of them we just monitor and they do not need treatment unless the platelet count is very low. But the most important thing is to make sure that there is no other reason for these low platelets. So we do a series of tests to make sure that there is nothing else is wrong in the blood and it is only ITP. Once we confirm that it is ITP, we next see the platelet count. If the platelet count is not very low, we usually what we call wait and watch, that is observe them and keep them under follow-up. If the platelet count is very low, then we have various modalities of treatment, and this treatment will be used if the platelet count is very low, or number two, if there is bleeding from anywhere because of the low platelets. There are various modalities of treatment. The commonest being used is something called giving IVIG. This is giving them immunoglobulins, which will prevent this destruction of the platelets, and the platelet count will come up. In some situations, we may give other medications called steroids, called prednisolone, which also does the same job. Usually, if we are giving steroids, it might have been given for short periods so to prevent the side effects of steroids. So usually children who present with what we call the ITP do very well. And it's a self-limiting disease, and within a few days platelet counts will return to normal and they will go on to have normal lives. But in a short proportion of them, this low platelet count can recur again. That means they may not respond, or this may keep happening again and again. And if this goes on for a long time, say more than 1 year, we call it chronic ITP, and then we will have to do some more specialized tests to rule out other problems, and they are treated in a different way which will need prolonged treatment. ITP and any other blood problems in children can be treated at our hospital, in the Aster Women Children Hospital, which has got all the facilities including blood bank where we can give blood transfusion, platelet transfusion, and all the facilities are available under one roof at Aster Women Children Hospital.